Okay, so
Come on. Easy,
Nick. Pressure, what do I have?
Come on, easy, help.
Oh.
He needs help, come on.
Oh.
It's okay.
Are those the cops, man?
No, it's not the cops, man.
I don't want to get arrested.
Come on, help.
Hey. Oh.
Christian, stop moving.
Oh.
Okay.
So what I'm doing now is quiet just a second so you can get from this. Even with all the noise, the first thing I'm doing is trying to look at the whole picture. I hear yelling from the patient on the ground, so I know his ABCs are good right off the bat. I hear them squawking, that's fine, they care about him. They're not finishing him off, they're actually looking like they can help him. Okay, at this point I'm trying to look at the mechanism, I see the wall, I see the spray can, I see I'm a badass, and I see a guy that looks like he's hurting, okay? So when the scene assessment is there, so I'm gonna continue on scene. What's going on, guys? Okay, for just a second, hold on. What happened? What's your name?
My name is Kevon.
Kevon. Grant. What happened?
He fell.
He fell? Okay. And what's your name, Mike?
Christian.
Christian, where are you hurting right now?
All over my leg.
Okay. Is it hurting right where you're holding it?
Yes.
All right. Real couple quick questions, Christian. How did this happen?
Are you the cop?
No, I'm an EMT.
I was spray canning on the wall over there.
Okay, you can't
I
spell.
fell.
All right, good. But you remember everything that you fell down? When you fell down? Good.
Yeah.
So what I've determined is he had a loss of consciousness in the injury. Okay, perfect. All right, Christian. And first off, would you do me a favor to stay right there because I'm going to be doing some stuff on his leg. So you kind of talk to him, tell him what's going on. Christian, we're going to take your vital signs and we're going to get your blood pressure and everything else. Your friend's going to talk to you and we're going to check out, see where you hurt, okay? Relax as best you can. On a scale of 1 to 10, with 10 being the worst pain you ever had in your life, what is this?
It's hurting. It's like
It's
a
like
12.
the worst ever? Perfect. Hang tight a second, okay? All right. Check your skin signs. Got a strong radial pulse. Got normal skin signs. Do you have any medical problems that I need to know about? Heart, liver disease,
No.
anything like that?
No.
You take any medicines?
I was smoking yesterday.
Okay, but any prescription medicines?
No.
Do you have any allergies to anything?
Cantaloupe.
Cantaloupe. All right. Dispatch. Like to go ahead. We have a possible femur fracture. Start us an ALS unit. Also get law enforcement for backup. Okay. So when it come down your leg,
They're going to take good care of you.
Christian, I want to keep an ear out on me. How's your right leg feel? Can you
my
move
right
it?
leg's fine.
Can you move it out for
Yeah,
me?
I can.
Perfect. Can you lay it down? Okay.
Sure.
Perfect. Okay. And sit there. Oh, nice
no.
knife.
Yeah, that's my knife. It's
All right.
for safety.
So what I'm going to do is I'm going to give this knife to your friend if I trust him. If I don't, I'm just going to set the knife
Don't
to the
give
side.
it to him. Give it to her.
Okay.
Vitals
Give it to
are
him right
148.
So, got your knife, we're going to keep it. Here, you take the knife and we'll throw it to you like that. What was the BP?
148 over
All right.
82.
Can I get your shears?
Is that real? Yeah, that was real.
Take the scissors. I'm going to start with exposing his right leg. Then come to the left leg. Now, first off, Christian, can you move your left leg at all? It hurts. Can't move it.
Oh no, I can't.
All right. So I'm going to just cut your pants off, and I'm going to try to do it slowly so I don't hurt you, okay?
Okay.
I'm going to cut the pants off. I see a preserved injury. I see what looks like maybe a swollen or mid-shaft femur fracture. Christian, I think you might have broken your left leg. Does that feel like what you have right now?
Yes.
Okay.
It feels a lot of pain.
I'm going to take your shoe off, your boot off as well as we can. And even before I do that, I'm going to try something, okay? I'm going to go under your left knee with my hand. And let me know how this feels. Okay, good. How about now?
Oh, that feels better.
Okay, perfect. So I'm going to hold this for the time being. Perfect. It's awesome. All right. Are you done with vitals?
Yes.
Okay, I want you to take your shoes off.
Okay.
And what you're gonna do is go ahead and take over for me. So take your right hand and bring it under his knee, meet my right hand. Good. Cup his leg. Now, see where my hand is? See, I'm kind of pulling with my right hand, and you keep pulling straight down just like that. How is that, Christian? Is that okay?
Oh, that feels good.
And if it hurts or adjusts, we'll adjust a little bit. All right, I'm gonna finish taking off his shoe. So, Christian, does any other part of you hurt right now?
All right, bro, it's like I'm broken,
No,
right?
it's just
Okay.
my leg.
Take your boot off here.
Man,
It's
you
very
careful with his
uncomfortable, I know that
with his
there.
socks, man.
I'm sorry,
There's
sir.
There's a pair of
Sorry,
socks, man.
sir.
Sucks,
I'm
man.
sorry,
I'm
sir.
gonna take your socks off.
I'll take care of you, sir.
Thank you.
Trust me.
Thank you.
And here you go. If you like your socks so
Can you
much.
feel your What phone touching, sir?
Oh, that's my thumb right there. I see my thumb. You're touching my thumb.
Are you okay? Is he on the crack?
Grant, is Christian special needs or anything like that?
Is he on that?
Okay, so
No, he's not number that.
continue on that right now. So now we have his legs exposed. I have the visible look here, and my first thing is to keep the pain control. We checked his distals. How was he on the left side, Elijah?
He's clear.
I have good strong pulses bilaterally. Can you feel me touching your big toe?
That's my big toe.
What toe am I touching? Your left foot?
Oh, that's my pinky.
Okay, good. Can you move your left foot at all? Is it hard to move because it hurts or because you can't
It's
move
hard
it?
to move because it hurts.
Okay, what about your right foot? All right, we got a solution for you, okay? You know how your leg feels better now? We're going to make that stay there, okay? We're going to make it even
Okay.
better.
Okay, so we're here, sir. These are fly socks, by the way.
Okay, Grant, what I need you to do is get some paperwork, start getting his age, demographics, address, med history, allergies, start filling out the PCR. Chief complaint, left leg, fracture of the femur.
Give me a pen, bro.
Okay,
Oh, I have a pen in my pocket.
I don't need your pen, sir.
Okay.
Yo, this shit got stuck. Hold on.
Yeah, man, you just stay still there. There.
all right. Christian, I'm going to slide this under you. You just keep traction on his leg.
All right, what is your name, sir?
This big got stuck.
Christian.
That's it?
Gandara.
I mean, sorry.
I'm going to pass it on the side.
May I have your full name, sir?
Christian Moneymaker.
Okay.
Okay.
All right, how old are you, sir?
Here.
Oh, I'm 20.
Your vitals were 140. I forgot. I mean, I would say out loud, but you remember the list, sir?
Where the hell is the...
Can you check his vitals again? No, you're holding.
Huh?
I think they were.
140.
They were.
Over 82.
Is 140 what?
42.
142 over 82. Pulse ox was 98 at room air. Your chief complaint was a broken what?
Left femur fracture.
Left femur fracture.
Mechanism of injury, falling while committing a crime.
Oh man, I was artistic.
We
man.
wouldn't say that was that falling.
Yeah,
Okay.
man, freedom of speech.
Alrighty.
Okay.
So we got that here.
Okay. Up.
Now, Christian, gonna feel a strap going under your left thigh. You just stay still. We'll get this, okay?
Okay.
This is just a strap, and we got a little, like it looks like a crutches going up in your crotch.
Okay.
So I'm gonna slowly advance it there, and if I'm starting to crush anything, let me know. If you need to move anything out of the way, go ahead and do it.
Okay.
You good?
Yeah.
So I'm gonna push it really
right
hard
there.
there. Is that crushing something? Okay. So now I'm taking over traction. You go ahead and apply the ischial strap there. So connect it. Don't trap his hand.
To your answer.
Yeah.
Because right now we got the traction. If this is a good femur fracture,
Sounds good.
this is going to be pretty much good with this for now.
Damn it. I eat all the snacks.
So bring the buckle around the top so you can tighten that down. There you go. Good job. Grant, did you find anything on the history I need to be worried about?
Elijah.
I'm sorry, Elijah. Why do I keep calling you both black? That's why. Shit. So, but you got the hairdo, and you got Jamaica. So, all right. So we got that set. We're gonna apply these here, and these things are incomplete. So we're gonna apply our straps right now. All right. So
Above.
One above, one
yeah,
below.
just we don't have enough, so we're gonna simulate that. Okay.
This one don't even want to shop at.
Elijah, do me a favor and recheck these distals for me. All right. Okay, on a scale of 1 to 10, 10 was what you were at when we got here. What would you say you are now? I know it's not perfect.
Can you move your
It's like a
toes?
7. I'm still
Okay.
the same.
I'm gonna do a couple other things real quick. Let me see your eyes. Okay, it looks like you're full up. They're brown. Pupils are pearl.
Stay
And
sharp, by the way.
I'm gonna feel back your head. Did you hit anything else when you landed that you can think about now?
No, it's not.
Okay.
That bad.
Gonna basically expose him. We'll check his
Good.
head to toe on the bottom here. And anything hurting, I'm gonna go down here.
No.
All right. How's your rib cage feel?
I feel good.
How's your chest feel if I pushing it? Pelvis, anterior, posterior. Give him a little stethoscope. Lung sounds. Okay, so distals.
Yes.
Alrighty. So as soon as the ALS gets you in, right now we're going to wait for the paramedic ambulance to get here so we can actually give you some pain medications.
Okay.
And or we don't have ALS, we're going to move him onto the gurney. And in this case here, I'd use a backboard. The way I do it, because his leg is busted, I'll take the flat of the backboard and go straight down the center. So it can basically, it's only to pick him up. Make sense?
Yes, sir.
All right, so we got the documentation, we got the times, and as far as EMTs, that's pretty much all else we could do. If we found something out of whack, retake his BP, retake pulses, and because I'm me, I'd put a pulse ox on his bad toe to check for compartment syndrome or occlusion of circulation. All right, so guys, call-wise, this isn't clapping because there's always stuff I could do better.
Dang, well, that's
What
pretty
was
funny.
the flow? Tell me about this call. How did it feel to you, Christian, as a patient?
Felt better. Felt in control.
Okay. Felt better, felt in control. Elijah, how did it feel to you as a partner?
I felt like we were doing the right stuff, man. So I was able to follow your lead.
Why did you feel I was doing the right stuff, though? Feeling is one thing, knowing is another.
Because the patient was responding well to your actions.
Did you feel like you had something to do?
Yeah, I was working
Okay.
on my start.
What about you? What made you feel better as a partner?
I felt like
By the way, this thing wasn't even working right, so I adjusted it without saying anything en route, because that happens. Sometimes you have broken gear or whatever. Don't say my gear's broken. Make something happen. Or we need a different one, something basically inert, okay? From your guys' observer status, what did you think?
There was just more control. You had better idea of what you were doing.
So just to run through the scenario again so you guys kind of know what I was thinking. One thing I'm talking to you guys the whole time. I'm giving directions. I'm delegating as much as I can because I can only do one thing at a time, okay? So my first thing was, as I come on scene, look for the obvious hazards, try to identify the patient count, figure out what's wrong. Because I have people there, depending on who's talking to me first, I'll go to the bystanders. A lot of times they have something they want to tell you. Then I confirm it with him. I can look and listen to him while I get the story from the bystanders. Their way they're behaving tells me a lot too. All right. Quickly identify the chief complaint, which is a leg fracture. But while I was doing that, I asked him his meds, history, allergies, and blunt language. Don't ask medical history. That's stupid. Okay. So do you have any medical problems? Medical history is jargon. Medical problems anyone can relate to. Do you take any medicines? Well, nothing prescription. I don't care. At that point, I'm looking for anything prescription meds, major problems, allergies, because if he subtly goes out on me, there goes my chance to find out something I really need to know. Passing on. Then I go to a focus assessment, which is his legs. I always start with his uninvolved leg. Can you move that leg? Cool. I have a baseline. I also start with his unthreatened leg, because no one wants to be moved when they're hurting. Next, I tell him step by step, I'm going to check this, I'm going to check that. You ever had a kid, like a little sister or brother, and they have an owie, and as soon as you move towards it, they get all like flinchy and stuff like that? Because they're scared. I'll say, I know your leg hurts, okay? And I'm going to do this really carefully. Tell me if this hurts you, and I'll stop. Always working my way up there. I've already established that he's not going to drop dead on me any second. And if he did, guess what? Change the plan, go right back to resuscitation mode. Now I'm working with him. Tested it with the traction. Maintain the traction, because I want to get pain relief as fast as I can, at least what I can do. Ordered the ALS unit right away. Ordered LEO just because I never know. They might be bored. Okay? And proceed on. Now, I didn't finish my secondary, or even really a complete primary, so after I've got the traction splint on, I go back and do the pupils, do this, head to toe, if you will, and redeck the distals, lung sounds, and so on. Does that kind of make sense? Mm-hmm. So that's probably the hardest thing to learn, is how to adjust the call based on the problem. And that's a little bit artificial because of school. But if you said you were doing it for that reason, like with a good proctor, says, okay, we've got ABCs are intact, demonstrated by a strong radial pulse, good skin signs, ability to speak easily and breathe. I'm going to do a focus assessment and treatment because a femur fracture is continually hemorrhaging. I'm going to try to stabilize that, get some pain relief, and then I will complete the rest of the assessment, or I can delegate someone else, hey, check the upper body. If you really think it's a problem, which in this case it would be a problem, but just to do it. So does that help seeing another way of doing it?
Mm-hmm. Your time was good though. It was like 10 and change.
Really?
Yeah.
It felt like 30 minutes to me. Okay, so, but that's trying to show you because that gives you an idea, because that's how we all learn. When I was an EMT, I modeled off of the best medics I had. And also modeled off my shitty medics, because they're like, oh shit. Two thoughts went through my head. I don't want to be that bad, and two, well, if you can do it, I can. So, there's always somewhere, you can always learn from someone.
Or they did something wrong. Well.
Yeah, you learn from others' mistakes, probably even better, especially when the mistake was against you. Okay? You learn from.
Put it in the
Your
group chat.
job is to improve upon.